Hi guys, so today we're going to talk about all-on-4 treatment, and for those of you who don't know, all-on-4 treatment is for people who've kind of reached the end of life for their normal teeth. So they've had a lot of bone loss and a lot of teeth are loose, maybe there's a lot of tooth decay, and over time maybe you've lost a whole bunch of teeth and now we need to look at replacing all of your teeth with dental implants. Now the traditional way of doing this would have been to remove all your teeth, let the area heal. In the meantime you have dentures which are removable, and then you go through a process of building up the bone, placing the implants, and then having fixed teeth on implants. So what all-on-4 and teeth in a day, same day teeth, all of these things are the same thing, by the way. What they kind of promise is that you can have your teeth removed, all the really unhealthy teeth which you still have, you can have all of those removed, and then you can have the dental implants placed and leave on the same day with fixed teeth. So it sounds really cool, right? What a really good solution. So there's a couple of things that you need to know about this kind of treatment and the initial first stage, and I'll explain all of this to you now. So the first thing you need to know about this treatment is it's going to take much longer than you initially thought. The reason is through all the marketing and advertising, the message kind of gets across that everything is done in one day and you'll end up with an amazing Hollywood smile and you can eat whatever you want on day one. And this just is not the truth. And really what it takes is a couple of appointments, maybe 2 or 3 sessions usually in my clinic, where we discuss the treatment, discuss all of the options, and go through the treatment plan, take the x-rays, do the planning, take some models, and all of this kind of stuff has to happen before the main event, if you will. And even on that day, because your teeth are constructed on the day by a lab technician, there's a little bit of guesswork, so it's unlikely that you'll have an amazing smile that you're 100% happy with on that day, just because there's a lot of guesswork. We can't do any what we call try-ins, which is where we test out what the final teeth are going to look like before we actually do any treatment, because remember, a lot of our patients, they've got teeth in position first, and then we have to give them a fixed set of teeth perfect on that day. So if you're considering this kind of treatment, I would definitely, manage your own expectations and know that the set of teeth you get on the day, there's a little bit of guesswork. They're unlikely to be perfect. They look pretty good. I mean, here's a couple of cases that we've done recently, and functionally they look good. You have a nice even bite, the implants are strong, and generally the teeth do look really good and you function really well with them. But there are a whole bunch of little problems that you can get with these teeth, and I'll make a separate video about all of the problems that you can get with your all-on-4 teeth. Another thing to note is that there's nothing special about the dental implants that we use for all-on-4 treatment compared to the dental implants we use anywhere else. So really, the implants still need between 3 and 6 months to fully fuse with your bone. And there is no difference between the all-on-4 treatment and a normal single tooth implant, which in a lot of cases we would put the implant in, let the area heal, and then put a tooth on after that healing time. The difference with all-on-4 is because all the implants are connected, there's very little movement of the implants when you're chewing, and this is what gives the implants their high success rate. That's what gives this treatment its high success rate. But during the healing process, there are still things that happen. So after 6 months, the shape of your bone, the shape of your gums is going to change a little bit. And that's why I 100% recommend after about 6 months, you change the plastic bridge, the plastic teeth that you get, to a much stronger metal-based bridge. This is extra treatment, it's extra cost, but I would recommend it because really the plastic teeth that you get on the day are decent, and we reinforce it with metal, so they're pretty strong as well, but they will chip away, they will wear away more quickly, and as your gums move and change shape, you may start to feel a space between the actual teeth and the gums, which a lot of people can find annoying, but more importantly, you can get food stuck in there and things like that. Now, when you're looking at this kind of treatment, a lot of people will think, oh my god, this is going to be the most painful day in the world, can I be put to sleep, and all of this. And yes, you can have sedation, it is possible, but a lot of my patients will actually have this just with normal dental anesthetic, and you would be amazed at how little pain there is in most cases afterwards. Yeah, you're going to get niggling, yeah, you're going to get a bit of swelling, possibly bruising, but usually after a few days all of this is gone, and it suddenly feels a lot better because we've got rid of all the infected teeth, we've got rid of all the infected gum and things like that, and you're left with good solid implants, solid teeth on solid implants, and every time you look in the mirror you're actually pleased at the way that things look. So you're more motivated to keep things clean, and as long as healing occurs pretty well, afterwards, after that day and even on the day, there is very little pain and discomfort. So you may be thinking that, okay, look, you're possibly going to have this treatment, you're going to get rid of your teeth and have a new set of teeth which you might need to have for up to 6 months, for example. How do you know that you're not going to end up with teeth which actually look worse than where you are right now? Well, that's where all the planning really comes in, and even though we can't try in teeth in your mouth, we can still do like what we call a digital smile design. We can then take this design and make mock-ups, so we can analyze how your teeth are going to bite together and look at all of these things on models. Now, it's not as great as having it in your own mouth, but it is a good starting point. And we're going to use smile design principles, so we know that if we look at someone's smile, it has to be kind of parallel to their bottom lip when they smile. We know that as people get older, they show less and less top teeth, and that gives us an idea of how long the teeth should be. And by using a lot of these kind of smile design principles, we can help guess that perfect smile. And for a lot of people, it's a dramatic improvement. However, we have got room for improvement on that at later stages. Now, this is probably one of the more complex kind of things that we do in dentistry, and especially implant dentistry. And you might be wondering how much this all costs. And every dentist is different. If you've got separate dentists and separate implant dentists, and you've got a team for sedation, obviously your costs are going to be a lot higher. For my patients, because I do everything from beginning to end, this usually costs around £15,000. And these prices can change as the cost of our implant components change and things like that. And if your case is particularly complex, then it's not going to be that, that £15,000 figure. It may be more, it may be less. Remember, there's a lot of different options when it comes to implant treatment, and All-on-4 is a pretty top-end option. If you're looking to replace all of your teeth with dental implants, there may be other options which are less expensive, and maybe we don't do it all in a day. So the best thing is always to have a consultation, have a chat, discuss your individual situation, and take it from there. So thanks for watching. I hope you found this video useful. If you've got any questions about this kind of treatment, you can always just pop them in the comments below. I do read all the comments, and I try to get back to most people. And if enough people ask me for a certain aspect, then I'll make a whole video about this. I know from experience, when I'm talking to my patients and we're discussing this kind of treatment, there are 1,000,001 questions that you need to know before actually, saying, yes, this is 100% what I want to do. So, hit me with your questions, and I'll try and get back to everyone. So I'll see you soon. Take care.